That's what's coming into your tea, and it's highly medicinal. And people who use cannabis tea are getting the benefits of the cannabis without the psychoactivity, because the cannabinoid acids are not psychoactive. A couple more things about ingestion. We see concentrated cannabis oil, as Mara was talking about. There are times when you want to really concentrate your dose, and that is usually delivered in a concentrated cannabis oil. As a matter of fact, I don't think I know any other delivery method that delivers a concentrate, well, rectal. Come to that last. This is the most commonly used delivery method for concentrated cannabis, is as an oil. And those are becoming more and more available in dispensaries here in California. People can go in and buy, a gram of cannabis oil in a syringe and take it home. But it's really important to know that this is loaded with 100 times more medicine than you're most likely to use. I think I'll cut in with the rectal right now. So rectal suppositories are another method. I hadn't included them before because they're not widely available. Last week a patient came to my office, a cancer patient, and she brought in with her Tooshies, Tooshies, rectal suppositories that had 200 milligrams of THC in them. And this was a delivery method that she was going to use to treat her cancer. Very, very, very potent. So the concentrated cannabis oils and other concentrates, you have to be really careful. They're very strong. Okay, what can we say about ingestion? Is there anything good about it? Yes, the best thing about ingestion is that it lasts a long time. If you want to dose your medicine in a twice-a-day time frame, the only way you're going to do it is with an ingested medicine. And that doesn't really get you totally 12 hours, maybe 8 to 10 hours, but it's as close as we can get. Also, people like the idea of using food as medicine. Are there disadvantages? Well, yes, indeed, because you're trying to carry around a cookie. How can you do the dosing? What do I take? Do I take a bite? Do I take a quarter of a cookie? So that's not the greatest delivery method for specificity. The next one, sublingual delivery, is really good for specificity. Those are methods where the cannabis dissolves in your mouth, you put it under your tongue, or you spray it in your mouth, or you swish and swallow. Tinctures, mouth sprays, lozenges, tablets, mouth strips. And the best thing about sublingual is that it's easily transportable. There's no obvious cannabis odor. This is what's been used in the pharmacopoeia back in the 1800s, 1900s for a long time. And it's easy to dose. Drop by drop, spray by spray. And this is my favorite method, actually. I use it with about 50% of my patients, mostly tinctures. Okay, we're going to move on to topical delivery. What is most important about topical delivery is you can target the area that you want to treat without involving all the cells of your body. That is absolutely amazing. I have patients in my practice that are into their 80s, 90s, and up to 104 years old. They love their topicals. Arthritic joints, they rub it on, it makes the pain go away, and they're believers. So we see here a cannabis salve and a cannabis cream. And salves are good for conditions where you want to treat the skin. And the creams you can spread over a larger area. There's also massage oil, and there's the cannabis patch. Patches are a different form of topical delivery in that they're designed to have absorption through all the layers of the skin into the circulation. So these cannabis patches actually allow the materials to get into your circulation. These other topical methods pretty much stay where you put them. So what do we know about topicals? Why do we want to use it? Absolutely to target the area that you want to treat. Second of all, it has no psychoactive effect except for the patches, which are absorbed into the circulation. Very important. And I often will prescribe an internal use of cannabis and an external use of cannabis, so it doubles your dose. Talk a little bit here about raw delivery. Many of you have never heard of this, but here in California where I practice, there's lots of cannabis growers and growth and lots of farms, and there's lots of plants, and there's enough plants during harvest season so that at some point some people decided to juice leaves and see what happened. And this became a thing sort of in Mendocino County, Humboldt County in California, and they decided, well, the leaves only contain 10% of the cannabinoids as the buds, so what happens if I throw a bud in? So there's all kinds of protocols out there for juicing leaves or leaves plus a bud. You have to put it through a wheatgrass juicer because it gums up the works. Put some other vegetables in, and you get raw cannabis vegetable juice. So this is not something that's available in dispensaries, but it is really good for your health. What's the benefits of raw is that it's a superfood high in chlorophyll, vitamins, and minerals. It really has helped a lot of patients with chronic disease. We have so much to learn about what is happening to these patients when they use raw juiced cannabis. Their life turns around. Not just one, but I've seen like about 20 to 30 patients whose life turns around. Their chronic disease is totally alleviated. I have a colleague that is flying here from another country for the summer to undergo a raw cannabis juiced program for his health. Okay, are there any risks? Well, there might be mold in the cannabis. You don't want to put that into your system. And of course you need the equipment. Okay, I want to spend the rest of the time talking about summing up what is important about delivery. What are the most important points? Why do we care about delivery? Like I said at the beginning, what the person can get into their house, what is available in their area, what they can afford, that determines what they're going to use. So we can talk about all of these great delivery methods, but if you live in an area where there are no dispensaries, where you have to grow your own marijuana, then you're going to have to learn how to make all these different compounds, or you're pretty much limited to what you can do with the raw plant. The second most important thing about the delivery is that the method determines how long your medicine will be active. Do we want a twice-a-day dosing? Do we want a 3 times a day dosing? Typical story is people who smoke marijuana to try to help them sleep. And they say, it works great, except I get up in the middle of the night and then I have to smoke again. I said, well, that's because you're smoking. It's a 2 to 4 hour delivery method. So you need to do a 6 to 8 to 10 hour delivery method if you want to get through the night. Really important. Now, some methods use the raw plant. This is good for homegrown. And many people throughout this country that are allowed to grow their own medicine, you're either going to have to smoke or vaporize or learn how to make butters, tinctures, extracts, topicals. Shelf life. What if you're growing outdoors and you only have once a year that you do your harvest? So tinctures are awesome because you can extract full terpene and cannabinoid content into an alcohol tincture, and it has a shelf life of several years. We really like tinctures. And then back to what it costs. That's the last thing I want to say, is that I love many doses per bottle because you pay for each capsule, but in a tincture bottle you get about 15 to 30 doses. So you're the patients. What you can afford will determine your delivery method, and I really hope that there are options in your area. Thank you very much for having me.
Imagine a world we could live in, planting seeds in the minds of our children. And these trees and grow our solution. Hemp can heal the world. Imagine a world we could live in, planting seeds in the minds of our children. And these trees and grow our solution. Hemp can save the world.
But remember, it took 400 years to convince white people in America not to own black people. You can see why this is taking so long. We can't even treat each other with kindness, let alone treat the chickens and the pigs and the turkeys and the insects of the world with kindness. But I notice you have clothes on, and I notice if you have a cell phone, you have a computer, it is unfair to pick one thing that lions do that you want to mimic, when you don't want to mimic anything else they do. When lions walk up and greet each other, they sniff each other's ass. When I came in this room, you did not kneel down and sniff my ass.